Hi, my name's Dawn Brooker. I'm Professor of Dementia Studies at the University of Worcester, where I'm in charge of a research centre called the Association for Dementia Studies. We do a whole range of research around social aspects of improving quality of care and quality of life for people living with dementia and their families. I want to talk today about a research project that we've just completed called the MeetingDem project, and this was to look at the implementation of the Meeting Centre support programme for people living with dementia. Meeting centres originated in the Netherlands following a community needs analysis that asked people who were living at home with dementia and their families and other stakeholders in health and social care what people would need in order to live at home for longer with a good quality of life. And that's how the Meeting Centre support programme was born. It started with a number of experimental meeting centres in the Netherlands in the early 2000s, and the system of service delivery has been refined and researched since that time. And they've now gone from having a few experimental centres in Amsterdam to 144 across the Netherlands. So the research that we've been involved in is a JPND funded project which has looked at whether we can take the learning from the Netherlands and try and implement that in 3 very different European countries. And those countries have been the UK, Italy and Poland. And this, over the last 3 years, researchers have worked together across the 4 countries with the Netherlands to look at how we can implement these in these very different social and cultural situations. And we've managed to, in the first year, open 9 centres across the 3 new countries, and specifically the bit that I was involved in most closely is the 2 centres that we opened in the UK, one in Worcestershire and one in Herefordshire. And then what we did, after we'd looked at all of the implementation issues about how you get a centre started in the country, was to do an evaluation study to see whether they had the same impact as they'd found in the Netherlands. So we looked at a nice control group of 25 people and their families in each country going through the meeting centre compared to 25 getting usual care. And we've got some great results. What this research has shown us is that actually the Meeting Centre support programme, which is low cost, low community-based, friendly type of intervention, works really well for people and their families. So if you want to hear more about it, the best place to look first of all is our University of Worcester website. On there you will find lots of links to lots of films about meeting centres, guidebooks on how these can be set up, and just a wealth of information. We're really excited about what we found. We're now, as academics of course, writing up all the research papers, but we're really hopeful that if we can disseminate the findings from this important service development further, then we can really make an impact for people and their families, hopefully across Europe. Thanks for listening.